From the Asgard Company Studios in beautiful Wichita Falls, Texas, from the finest mind in the modern fitness industry, the one true voice in the strength and conditioning profession, the most important podcast on the internet. Ladies and gentlemen, starting Strength Radio.
Welcome back to Starting Strength Radio. We are here on Friday, just like we are every Friday, and this Friday is a little different, as you may have noticed. Interesting things are happening in the world, and we thought we would not shirk from our duty to at least address them for you. I don't know if we'll make any more sense than anybody else. That'll be for you to decide, but we're going to talk about this COVID-19 situation today. And we're not going to talk a lot about the numbers. And we're going to explain why that is. By the way, we're here with our friends, Andrew Mueller, who is an oral surgeon here in town. He's a man of above average intelligence. And we're here with Dr. Bradford, a woman of above average intelligence. And you'll have to make your own decisions about me. But both of these people are well educated. Stef's degree is in pharmacology. She has a PhD in pharmacology from Duke. I don't know if we've mentioned that before, but it's worth noting that she has had both research and clinical experience. Andrew is both an oral surgeon and a doctor, and a
business owner.
And a business owner of multiple businesses around the state, and is in a position to address the effects of this situation, not just the medical effects and the physical effects, but the financial effects, which have only begun to be profound. So let's talk about a little bit of this data, and we're going to talk to you about what the data is and what it is not. All right. Right now, as of today, the coronavirus cases reported, this is tested positive, are 912,998. The deaths are 45,551. That's about a 5% death rate, which is an enormous number. All right. By country, Italy is reporting by far the highest death rate. They are reporting 13,155 deaths on a total case load of 110,000. So that's a little over 10% death rate in Italy, which is very interesting. The USA is reporting a total of 205,438 cases, with a total death rate of a total death count of 4,528. And all the other countries of the world here, China is reporting a total of 81,000 total cases in the country where this pandemic apparently started. This is fascinating. China is only reporting 36 new cases today. The population of 1.5 billion people. They really got this thing whipped, don't they?
Well,
and
it's not the testing; it's who counts the tests.
It's like who counts the votes.
Exactly.
Same kind of thing. New deaths, 7 out of China.
Impressive.
Oh, that is impressive, isn't it? It is an impressive piece of work. And, there are little hot spots around the world. Luxembourg is interesting, tiny little country with 2,300 cases of COVID-19. They probably share some important characteristics in common with Italy. I've got 3 graphs here that were lovingly posted on my board today. Here are the daily case counts in New York City. All right, and I'm going to give you the numbers because I just want you to look at the graph. All right. Here are the daily hospitalization counts. Note the curve in New York City. And here are the death counts. Note the curve. Now, death counts, the last bar is probably not accurate, but note the trend. Okay. I don't see anything exponential going on. Do you guys?
Well, it's not what you'd expect.
No,
From
exponential
a
is not
course-
what you would expect.
No, you not for any length of time. That's not.
No,
how
it's not
epidemics
sustainable.
proceeds.
I pointed out the fact that if these models that don't, these scary models that just show hockey stick data, that by October the 1st, the entire mass of the observable universe would consist of coronavirus particles.
Right.
If, in fact, it didn't tail off.
It's pretty bad.
So that would be bad. That would be bad. You, me, all the dogs and cats, all the rocks and sticks and everything would have been converted to coronavirus particle. Okay, here's some other interesting data. This is from Worldometer. Worldometer, for those of you people in Iowa Park.
Okay.
Worldometer. All right. Communicable disease deaths this year. To date, this year. 3,254,000. Seasonal flu deaths this year. 121,882. Deaths of children under 5 this year. 1,905,000. These are children that don't die of coronavirus 19. Deaths of mothers giving birth in childbirth deaths, 77,485. HIV/AIDS infected people. This is not deaths, this is infections. 41,680,000. Deaths caused by AIDS this year, 421,424. That's probably predominantly in Africa, right? This is interesting. Deaths caused by cancer this year, 2,058,000. And as we know from our conversation with our friend John Horgan, the vast majority of cancer deaths are caused by smoking, something you do voluntarily. Now, this is a fascinating thing here. Deaths caused by malaria this year, 245,896. Deaths by malaria.
Yeah.
Malaria. Deaths by smoking are 1,253,000 and some change. Alcohol abuse, 626,996. There have been 268,000 suicides this year. Okay? 268,000 suicides.
So even these are not coronavirus numbers that you've just been going through.
No,
but
no.
Even these numbers have a lot of problems in them, right? I mean,
Absolutely they do. And let's
how
talk about
how do you
this.
define that somebody died from cigarette smoking versus alcohol versus cancer
when they
could have
undoubtedly
been
had
all three,
had
right?
all three at the
They're
same
smoking and drinking themselves to death as they have stage 4 cancer.
Absolutely.
Right.
So
Here's
let's talk about
be careful
specifically
about numbers. Yeah.
the numbers with respect to coronavirus to illustrate the problem with every bit of this data. Every bit of this data is shit. It's shit data. All right. First off, the Italian data, in fact, I posted this on our thread about this on the board. The Italian data, it was revealed about 10 days ago by one of the doctors keeping track of the data in Italy that 88% of those people who had previously been attributed to death by coronavirus, 88% of them died with the coronavirus, in other words, tested positive, but of other causes. Now think about that. This is profoundly interesting because how do you know that all of the rest of the data, the 45,000 people that I quoted, 45,551, were not similarly confused with causes of death other than coronavirus?
This is the thing. It's just like any sort of study you're looking at, any kind of numbers. You have to look at the context. You have to look how the data is actually gathered. And when you're comparing one thing to another, just any kind of deal, it's actually very difficult. So if you look, you get these studies that try to combine a bunch of studies together, a big meta-analysis. And whether that's actually done well or poorly depends on how they're putting these things together, where there really weren't, the numbers were collected differently, the criteria of those studies are different, and how do you try to get a bigger and bigger sample size, right? No. And that's always a problem. That's a problem when you extrapolate from, here's a study. It might have been well done, but you can't extrapolate it to all these other populations. I mean, you can extrapolate it, but whether that is justified and whether the predictions from that extrapolation are valid, you're going to have to find out.
Right.
And depending on someone's perspective, they're trying to sell you that it's
right. And I think that's the point we're trying to make is we need to be, when we're having discussions, it gets really dangerous once we start discussing numbers at all. The numbers, they're really, really questionable. There's a lot of problems with any study, whether we're talking about things not related to coronavirus or we are, and yet we're making major policy decisions based on these. We need to be aware of the limitations in the numbers.
Yes, we've been making major policy decisions based on a projection by these people at the CDC that U.S. deaths could reach 2.2 million.
Right.
And it's,
there's a whole lot of assumptions and extrapolations.
Bizarre.
Yeah, but I would like to make the point that I hope we can all think critically about this and step back and just ask. We've all gotten really, really focused on the numbers in the country.
Sure.
And the point I want to make is that the numbers, there's problem with the numbers, and we need to be aware of the fact that there's problems with the numbers.
Well, let's talk about the
careful.
Italian numbers as an example. Okay, Italy's got apparently a far higher death rate, a far higher case fatality rate than every other country in the world. Now, there are several reasons why this might be, and there are several reasons why that data should be completely ignored. What is the case fatality rate? This applies to all countries. It applies to every one situation. The case fatality rate,
right? We don't know,
is a number that we don't know.
Mm-hmm. So how is it calculated?
But it is calculated from people who have been tested, and if you are tested and you test positive, then you are included as a case. All right. Now, they are specifically reserving tests for people who are symptomatic. Mm-hmm. Now, this is interesting because that in itself is going to skew the data quite thoroughly. Mm-hmm. The only nation I am aware of that has done a good job of conducting random tests throughout the population, in other words, tested a random sample of people, not just symptomatic people or people who think they've been exposed to it, is Iceland. And the Icelandic data is pretty good. They've tested, best I can tell, about 8% of their population. And what it shows is a very, very low case fatality rate because in Iceland, they have got a handle on how many actual cases they've got. Because the more people you test that are asymptomatic, the lower the case fatality rate is, just because of the algebra.
Right.
Correct. I got this. I've got this correct.
Right.
The other data point is called the infection fatality rate, the IFR.
Which we'll never know.
Which we will not know. Now, why will we not ever know that?
We'll never be able to test everybody, and then they may already be cured. I mean, we could theoretically test for antibodies at some point and know how many people are exposed. But there's just a lot of data we're never going to know.
What does the test show now? What is it?
They're mainly PCR tests.
Mainly doing PCR tests.
Yeah.
Right.
So,
and PCR tests are not particularly reliable. For what reason?
Because what you're doing there is you're multiplying the genetic material, right? You have 2 strands of DNA, right? You unzip them to double them. If you're gonna duplicate them. So the idea with this, what you're doing is you're unzipping, and then you make a new strand here, a new strand there. So you take this double strand, so 2, you multiply it in 4. The 4 you multiply in 8. Okay, so what you're doing is you're making a reaction where you're basically doing what? An exponential increase. So you can have a very, very small amount of material and make a giant amount of it by using this reaction. Okay, so it's useful for manufacturing stuff, for testing things, all sorts of things like this. But inherently, since it's so very sensitive, you could have the tiniest little amount there, and theoretically, if you do enough of those things, it's going to show up as positive. You set a cutoff for what you count as, there. But what actually happens in practice, any kind of contamination, big one is, you get your dandruff in your test sample. Now you've just multiplied that instead of what you were trying to do, right? So it's very easy to get something in. So some of the numbers I've seen for some of these tests, and there's been various people making tests. So it's hard to get a positive. There's been multiple tests on people. You get a negative, they test them again, you get a positive. This was going back to China's testing. They were testing people, and they have to test them again, and they use multiple things, and this guy would be negative, then he'd be positive, then he'd be negative, because the test itself relies on just getting a tiny little sample, so we're trying to pick up a little fragment of the virus, then we're multiplying it.
And if the sample's wrong...
If the sample's contaminated...
Or contaminated...
Right. Or if you don't pick up anything in that particular swab... Right? Or the cutoff, let's say the cutoff is
just 20, not enough virus laying around to be in that swab.
Right. If the cutoff was like 20 cycles or 20, cycles of doubling it, right? If the cutoff's 20 and you don't get enough, you're below threshold. So it's a threshold kind of test. It's not an absolute kind of test.
So we know that there's problems with the testing, there's problems with the numbers, there's lots of problems with any data entered in this discussion. I don't think any of us are sitting here trying to say this coronavirus is not a problem. I mean, this is a huge problem affecting the world right now. We're also not trying to make light of it, but I think our goal is to make sure that we're asking thoughtful questions about it.
Right.
And because right now the narrative, as it seems, there's a lot of panic, there's a lot of fear, there's a lot of focus on the numbers, and there's a lot of really what seems to be possibly worst case scenario in a lot of people's minds that are being presented to them. And a lot of this, you see this with anything, when you all of a sudden start paying attention to an issue, now you're focused on it, it becomes more of a problem to you. We could be looking at influenza at the same time here. This is a test, it's done all the time. Most people don't get tested for influenza either. Most people, if you get a little bit of the flu, you just go, I guess I have a flu. You don't get it diagnosed. So the numbers for, say, influenza, they're based on samples and certain people are tested, but it's not like everyone gets tested for influenza either. That's why if you go to for example, you go to the CDC's numbers, they have an estimate, it's this huge range for something they can test easily, and it's based on sampling. We may do that at some point for something like the coronavirus too, but those numbers are these big, giant ranges. And what do they tell you? Right. Oh, this looks like a bad flu season. Our vaccine that doesn't really work very well is really not going to work very well this year,
Right. Right. In other words, the data for influenza and coronavirus are not analogous.
Well, because they're trying to do extrapolations.
They're doing
sampling.
2 different things.
Right.
When they're testing for the flu, when they're making flu projections, or telling us the number of cases of the flu, and we're telling us the number of cases of COVID-19, they're telling us 2 completely different things.
Right. They estimate that you have some testing, and then they project the estimated infection.
Right. For example, H1N1 back in 2009, there were apparently, in retrospect, we've decided there were 61 million cases of that flu. And of those 61 million cases, 18,000 people died. And this is a huge number. But it's not a particularly huge number when you think about what the flu does every winter. It kills people. The flu kills people. People die of the flu every single year. And I'm sorry about that, but that's just part of being here on the planet with viruses. And it kills a certain demographic. It doesn't kill children, usually. It kills old people, like me.
It's the same profile you see with coronavirus. Not very many people, and as you get older, it goes up. And if you get plus 65, it starts going way, way up.
Way up. And it goes way up if you smoke. Way, way, way up if you smoke.
And there seems to be similar data with the coronavirus, especially out of China. The smoking was a huge risk factor.
One of the things that keeps getting kicked around is the idea that we're going to overwhelm the healthcare system. All right. It's not a healthcare system, it's an industry. All right. And overwhelming it will happen in some locations and will not happen in other locations. For example, in Wichita County, the healthcare system will not be overwhelmed. We have an empty hospital out on Kell right now with nobody in it because all elective procedures have been put on hold due to an anticipation in the overwhelming numbers of coronavirus patients that are anticipated within the system. Now, what is the cost of that? What's the cost of
this is another brand new experiment that we have no idea what the cost will be, right? We have to just shut down a huge portion of healthcare and then see what happens.
What are they doing to your office right now?
Only emergency cases. So only patients in severe
and
pain. And that's how we're proceeding. There's been a lot of that's a very difficult question to answer, and we've gotten varying explanations from different governing boards. At one point, it was only life-threatening was the way that it was described. But then, you have patients in severe pain or even moderate pain. I mean, where do you draw the line? And I think all doctors right now are struggling with that. It was softened a little bit by the state of Texas, the medical board yesterday. Their language had been really aggressive maybe a week ago. It's another unknown. It's just what will be the results of this?
Yeah, so you think about what does elective mean,
I need to get this cancer cut off my face.
Right, yeah.
That's elective.
Well, is that
elective? That's not, no,
what about
they're
tests,
proceeding with that.
So you have a new person, coming in. There's something wrong with them. They don't know what it is. Maybe it is cancer, right?
Right. So if there's a concern for that, those are still happening. So if a biopsy, if there's the thought of the potential for cancer, that's still happening, or an infection. So there is still stuff going on, but
drastically reduced.
It's drastically reduced. I mean, we're
like all the derm offices are closed. I'm sure, right?
I believe so. I don't know for sure. I don't know.
I would imagine that the vast majority of dermatology is going to be called elective.
Right.
Under a circumstance
almost
like
all
this,
the general
that's how many melanomas will go undiagnosed during this period of time as a result of that.
Sure.
There's and multiply that over the whole healthcare industry because things that look to a bureaucrat like elective may not be elective to the patient.
Yeah, yeah. Right. So if you think of something like, I mean, I don't know if you've spoken to Owen, but like, what about joint replacements? Is that elective?
Yeah, right.
Those elective?
Right. If you can't
walk, you can't sleep.
Right. Absolutely.
Is it elective when there's an actual fracture that could lead to some kind of infection versus you're just in a lot of pain? Well, just stay in pain a little bit longer. Here's more drugs. And you'll be fine. Yeah. You'll be fine.
Except we can't give you hydrocodone now because of the opioid crisis, the nation's opioid crisis.
Whatever.
And this whole thing's a great example of just where the hysteria can quickly go too far. Just a week ago, I got a letter from the Texas Medical Board threatening jail time for doing non-life-threatening procedures. And then I got
for you.
And then I got which was shocking. I got a letter yesterday from them clarifying that they actually don't have the ability.
That was harsh.
They don't have the authority to throw doctors in jail.
So at the same time that several jurisdictions across the country are letting people out, some they're nonviolent, we're letting them out. Other ones, yeah, they might have killed somebody, but they're old.
We're going to throw
and
the doctors in jail.
they let those people out, right? Because, well, what if we get
they're
stuff
gonna
in an institution where we have to take care of them,
Right.
and if it's our fault if they get sick.
But doctors
we're
and
gonna throw you in jail.
scofflaws.
You're going to go
by
in jail.
God,
We'll arrest you.
Right.
You
We can keep you
are-
in jail.
Yeah.
You
It's like,
are
wait a
defying
minute.
our
Right.
authority.
Right.
And we
That's
don't
always
like
worse
that.
So if you hear that and you don't think that we're potentially overreacting in some ways, then I don't think you're paying attention to what's going on.
I don't think you're.
Yeah.
I don't think you've adequately appreciated the situation.
And so what are we trying to get at here? Because we've made a really big reaction in this country.
Yes.
And this is also completely uncharted. I was kind of thinking this morning, this is the first time we even had the ability to do something like this. I'm not sure that we could have sheltered in place
House
50
arrest.
years ago. House
House arrest is a
whatever.
proper term.
For the internet and the ability, Amazon Prime and all these technologies. I don't know that this would even have been possible. Now we have this massive social experiment going on, and it feels like we're doing that without a lot of conversation about the potential downsides.
Yes.
Of what could go.
We've
The
got,
phrase "is the cure worse than the disease" has been said, but are we talking about that enough? Are we asking those questions?
I don't think we are. We
I've
got
heard
a whole
that
bunch of
mentioned once or
people.
twice, but not continue to be talked about.
Got a whole bunch of people, several posters on the board, on the thread, and certainly the entire media is focused only on the disease. They're focused on the number of potential deaths that this disease will cause. They keep going over and over the data and pulling the death rates out and death projections and all this other stuff. And they're doing this in order to justify the reaction to this pandemic that governments, local, state, federal governments have taken to the disease. All they want to talk about is the disease. People are going to die every year anyway. It's always like this. People die of lots and lots of things. A lot more people died of malaria in the same period of time than have died of coronavirus. Now, that's not to downplay the potential threat from coronavirus. It is to illustrate the overreaction to that potential threat.
Potential overreaction, right? Yeah.
I don't think the overreaction is potential. I think this is an overreaction. You may not agree with that, Andrew, but
I don't know. I don't know.
I'm convinced this is an overreaction because
I suspect it may be.
I think some of the things you see actually give you that idea, right?
Yes.
So when you stop focusing on people that are actually dead and start talking about we could overwhelm the system and then you wouldn't have enough ventilators. It's like, okay, so I noticed there was a shift there from people actually dead to, we could overwhelm the healthcare system.
Well,
and then what's
why
the
are
next
we not asking what
next
could we be doing to the economy? That's
what's
not
the next step, right?
Yeah.
So we're and looking at one little part of what's going on, right? Mm-hmm. So you're just looking at one thing. It's like, our lives aren't made up of only living or dying from a virus.
right now we're looking at people who have died of COVID-19, whatever that means, in New York City.
Right, we're very, very focused on that.
We're looking at the New York City death rates
And we're
in hospitals in a giant city where people are stacked on top of each other like sardines. Okay.
And we're very focused on the quantity of lives saved, but there's not a lot of conversation going on about the quality of life for all of us.
That's going to remain at the end.
That's going to
of this
remain
thing.
when potentially, does anybody know what shutting down the economy for how long is going to do? And nobody does.
They don't because
Nobody
it's
does.
never been done before.
Yeah,
as Andrew mentioned, it might not have been possible prior to today's information technology situation.
Right, where people can work at home, and so yeah, right. It probably wasn't possible, and so
we don't know what the economic damage here is going to be.
Right.
It's going to be profound. I have seen estimates, and all right, I'll give you that. It's an estimate. It's a model. It's probably bullshit. But I've seen estimates of second quarter GDP. That's April, May, and June GDP drops 25%. That has never occurred. That did a quarterly drop of 25% did not occur ever once in the history of this country. It didn't occur at any point even comparable to that during the Great Depression in the 1920s and 30s.
Right.
At no point did the economy suffer that big a blow in that short a period of time. Right. But when you tell everybody to stay in the house, you tell 330 million Americans to stay home, unless you're a bureaucrat, and then you can stay home, still get paid. I wonder how many bureaucrats have lost their jobs during this little experiment. I'll shut up about that now because it just
fair enough.
Pisses me off too bad to talk about.
And Rip, if we knew that 150 million Americans were going to die, there's no question that we would all be. I mean, we'd be going through draconian measures to do anything we could to stop this.
Absolutely.
But if we knew that only one American was going to die, I don't think anyone would want to shut down the economy over that. And so the point about the data in the beginning is we're making these huge decisions that we don't know. We really don't know what we're dealing with. And, there are other things in life where we've thought about, is there a balance between human lives and the economy? Maybe it's a crass example, but speed limits is one that comes to mind. And, we've made a decision in this country that we're going to have efficient travel and raise speed limits. And we know for a fact that causes more deaths. If we all drove 20 miles an hour, there would be almost no car fatalities. Yeah,
right.
Very, very little human lives lost from car fatalities by lowering that. But we've made the decision to raise that, and as a result, we have more fatalities. In the same sense,
and
we have to balance the economic cost of this.
Think about that for just a second. There have been lots and lots of irresponsible politicians all over the political spectrum saying that if it saves one life, it was worth it.
Right.
Now, but kiddos, come on.
Well,
if it saves one life, it was worth it. That is fantasy land. That is Saturday morning cartoon level bullshit.
This is the deal. So your example of the speed limit's not bad because everyone understands that.
Yeah.
What you also understand is if it takes you hours to get somewhere, what have you lost? I mean, you've lost part of your life. Yeah. So it's a false thing to say saving lives versus the economy. You want to trade lives for money. It's like life. You're using my life. My life is getting used up. When you limit me, if you took me right now and put me in prison, or just think of these people that are they're in prison for 20 years and it turns out that the prosecutor hid the evidence and they let the guy out. It's like, can you make up for that?
No. And I think the other reason that it's helpful is we've been thrust upon a brand new problem. We've never thought about. Most of us haven't really spent time thinking about a global pandemic before, and we're all thrust upon the coronavirus is all new. The speed limit thing's helpful. That's something we've wrestled with for years. Right. And these are some of the decisions of years of looking at it, seeing the results, trying even different states have different policies. Right. And so there's been a lot of experimentation that's gone on there. And we've come to certain conclusions.
And we've traded death in other ways there. So another thing that's increased the traffic fatalities has been cars getting lighter and lighter and lighter to meet fuel efficiency standards. So the decision was made, fuel efficiency is more important in your life because you know how cars these days, you can smash them up. When I was a kid, you jump on top of the station wagon. It was steel.
Yeah,
it was
like
steel.
3/8 inch.
Right. And now it's just like tinfoil. You can pop your car hood in and out because there's hardly anything there.
I have to be a little careful with that example because I think the crumple zones in the newer. I'd rather be in a new light car.
There are safety features, but overall, and you can look this up. You can look up the cafe-related fatalities. Those things have led to more traffic deals. This has been, again, it's modeling, so call it what you want. But there's been more traffic deaths. It hasn't just been the speed limit. It's because you've made cars more fragile.
What about red light cameras? Now, there was an interesting thing. Texas just made those illegal. Governor Abbott just made those illegal. But how many car wrecks were caused by red light cameras across the United States?
Because people were stopping.
Because people are slamming on the fucking brakes.
Right.
Instead of going
trying to not get a ticket and then getting rear-ended, causing a chain reaction behind them. And there's a number attached to that.
Yeah,
Right.
yeah. So
And so-
yeah,
so
and
the-
there's
Because they wanted
Right.
the revenue.
Right. And the
because they
point-
wanted the ticket revenue.
Yeah.
All of this illustrates that public policy, whether it be economic or health, has dramatic impacts on our lives.
Yeah.
And, right now, I have the feeling that we have a very one-sided narrative that's all about the virus and how dangerous it is, and it very well may be. There's just so much that we don't know.
Right.
And we need to make sure that we're discussing the potential economic impact of this. And it doesn't feel like we are right
no,
now.
it doesn't.
Not at
And I
this
think
moment
I
in
think it's
time.
for a couple
No.
reasons.
Not to
One
a
is
big level.
to people, you can actually very effectively make a threat something you can't even see, can't you? I could be
Yes.
making you sick right now, Andrew. You can't see it. So
Right.
people start getting very spooked and hyper aware and,
So- and-
not letting
yeah.
their friends in their houses
Right.
and all these kinds of things because they start to get like
we're-
paranoid and creeped out. They've watched too many
We're programmed
horror-
that way, right?
They-
Like we're as human beings, the human that didn't run away when he thought there was a lion in the
Right,
woods,
right.
he didn't reproduce. They're all dead. The ones that had children are all the ones that ran away. We are the descendants of fearful humans. So we have to remember our brains are programmed to be fearful, and we need to be nervous about that.
True. But what the governments have done at different levels to different extents is say, screw your response. We're going to order you what you should do instead of letting the people
We're
that
not
want
going
to.
to let you decide.
We're not going to let you live your life.
Right.
We are going to decide for you.
We're going to take your life.
And
from
in other
you.
words, we're going to make the calculation that you would normally have made for yourself.
Mm-hmm.
We're going to make that
Right.
calculation for you. And if you don't do what we tell you to do, we're going to fine you $1,000, and we might even put you in jail, which is really a safe place to be during a pandemic, isn't it?
I think
there
my
are-
point is that in times of fear, we need to realize that we all make mental mistakes as a government, whatever. Because
And when you make emotional mistakes,
exactly,
that's what you're
because
talking
now we're
about,
not
emotional
thinking
reactions.
logically.
Right.
We're making emotional reactions, things because we're fearful, and we need to step back and be sober minded and
And some
think.
people are much more susceptible to that. And some
Yeah.
people should be more afraid. If you're in New York City, you live in a thing that puts you in contact with lots and lots of people constantly. You're touching surfaces constantly. You're breathing air constantly. That has about exactly nothing to do with where I live.
Yeah, how many people do you come in contact with on a daily basis?
If I'm
Steph?
lucky, none.
right.
But I mean, you don't
or maybe just
understand.
me.
You
Yeah.
understand?
But-
It's ridiculous when you talk about physical distancing, and I'm like, I live 4 miles away from anybody else.
Yeah.
Yeah, the rules that apply in the hippest city in the world, Brooklyn, don't apply in Wichita County,
Thank
out in the
God.
western part of Wichita County where
Right.
we live. The emotional toll here is going to be read rather dramatically in the suicide rate. We mentioned the suicide rate earlier. Suicide deaths in the world are, 300,000 every year. Whatever's in that pile. Something like that.
Yeah, it'll be interesting to see.
It'll be
unfortunately,
real
change.
interesting to see
Yeah.
what happens as people lose their businesses, as people who are already suffering from depression or deprived from social contact, as people with severe forms of mental illness don't get therapy, don't get treatment. This is a cost that our betters in the government have imposed on us,
And the other
with no thought whatsoever for the consequences of their actions.
Right. And the other physical cost, that hits really close to home is nobody's in the gym.
Nobody's in the gym. Gyms are all closed.
Is the best way to be prepared for a pandemic to sit on the couch?
be
and watch
trained.
Yeah,
TV?
so what are
Yeah.
positive things you can do? I mean, like normal people normally avoid people who are sick. If somebody has a cold, I don't want to be around them, and I certainly you're more careful about any of these things, touching your face, washing your hands,
Right.
if you're around someone who's actually sick, right?
Yeah, and I've never, somebody tells me they've got the flu when they come to the gym. The policy for the past 35 years at my gym is get the fuck out of here.
Right.
Turn around.
Right.
Get out,
And we're-
get
Right,
out
so-
of here.
Yeah.
So
you
people-
look
people-
like shit. I don't want the flu. I don't want the rest of these people to get the flu. Get out of here right now.
Yeah, so
That's
people,
always been the policy.
People avoid things, and all the warnings to wash your hands more and
All
not
of it.
stick your finger up your nose.
Right.
Right.
Or what else? I mean, that's and that's good for not getting the flu too.
And we're all aware that
Yeah.
we're all certainly aware that the possible difference with the coronavirus is people transmitting it before they become symptomatic, and that may be what's different with this is for influenza, and we're all aware of those issues, but it doesn't take away from the fact that of everything else we're saying.
Yeah, so just all the time, right? So people that are conscientious, you avoid people that are sick unless it's someone you're actually actively taking care of, and then you're kind of careful. And then you're not surprised if you get it from, your mom when she has the flu and you get the flu after you take care of her. It's like, well, that happens, but it's family, and that's how humans treat each other. But other than that, what decreases you getting sick just in general? I mean, what does being healthy mean? What does that mean for your immune system? Yeah. And not getting an illness, whether it's a flu, a cold, this thing, or anything else.
As we always say, stronger people are harder to kill.
Right, yeah, absolutely.
But we're not allowed to practice that right now.
Or suffering, or if you do get sick, suffering from it. So when you've done, when you've been physically active and you've trained and you don't have high blood pressure, good, because if you get this disease, from what they're telling us so far, one of the risk factors of you getting a serious reaction to it is high blood pressure. And you go, how does that work? Well, we don't really know, but it's a risk factor here. And if you don't have it because you've actually taken care of yourself, you're in a better position.
Right.
If you're eating well and not eating, Frito-Lays for dinner.
Right. So again, your whole point is great. It's not just the economic consequence, like I said earlier. It's not just saving dollars. By sitting at home, we are making ourselves more susceptible to the disease. I mean, you can't.
Well, and you're breathing everyone's same air.
Right. I mean, we're sitting there. We're getting weaker. Yeah. We're getting depressed. I mean, it's really hard to not be. Are you a little depressed right now?
I'm not. Well, and the thing is, I mean, I have a lot of people that I worry about because of their situations. Okay, yeah. But I don't go on and on about the fact that I go outside, I'm still surrounded by like real natural world, and I have no restrictions.
Yeah.
Right.
And I think you're in a unique situation, which is awesome. And you've purposely chosen to live your life that way. But there's millions of people who I think are getting depressed.
The idea, if I was stuck, if I'm
Obviously
anytime in Brooklyn, I start to get depressed just because of the horrible environment. But some people like that. They did like it until they got stuck in their apartment for 2 weeks, and they're looking at how much longer am I stuck in. I mean, just imagine being up in a building, up in the air, and you're like looking down, and you're stuck there.
Yeah, yeah. TV gets old,
and when you go outside,
but more important, you know what else gets old?
What?
Being broke.
Yeah,
gets real old. Being broke gets real old.
Not being able to eat.
And the economic effects of this thing have got to be considered.
They have to be weighed.
They have to be weighed.
Yeah.
A few people are talking about it, but what they have decided they're going to do is print $2 trillion out of thin air and just pass it out.
Well, worldwide, you see that. You see this stimulus idea, and that's maybe you can prop up the completely ridiculous debt-based economy. The world was in a terrible situation that it was bound to collapse sometime. A lot of people have questioned the timing of this, like, now we're going to pretend it was the virus when your banking system was completely paused already.
Yeah, so on thin ice.
But here's the thing. What I look at too, it's like if they push this far enough, what it's going to mean is there isn't food. And you know who's really going to die? All the poorest countries. The same people that don't have the DDT, and that's why they still have malaria in Africa.
Right.
Unlike here in the southeast U.S., we don't have malaria.
Sure. Yeah,
right?
It would be foolish to deny
those
that
people are going to starve. Most of the world does not.
Yeah.
Most of the world has to import food.
Right, because there's a legitimate risk of a true global Great Depression like we've never seen in our lifetime.
And if you want harvesting, if we get
has never occurred before.
Right, exactly.
Because of the interdependence that we've all entered into globally.
Yeah.
That's never occurred before.
Right.
There were when North America was isolated by two oceans, whatever happened here happened here.
Right.
But things aren't that way anymore.
Yeah.
And and we're in a situation that this is brand new territory. We don't have the slightest idea how this is going to play out, but it isn't going to be very good.
And there's other factors. There's other factors. So you don't know what's going to happen. So right now, like in the meat production, there was this big chunk, spike in demand, and just acute shortages just because of how people are sucking things up, right? Well, they've ramped up production. So right now, all the beef production, the pork production, it's all going in, so those things will be, the shortages will be alleviated. And we're talking about the U.S. where things are, pretty good, right?
Yes.
But if you look around, you're also going to see already that growers, people producing crops are saying, well, who's going to pick this? Who's going to get this stuff?
Who's going to pick strawberries this
who's
year?
Who's going to come?
Right.
There's been calls went out a couple weeks ago in the UK for people to pick their harvest because they import nearly everybody that picks things normally. Well, once you cut off the the flow of that, someone else is going to have to pick up.
We have bigger problems than we've had in my lifetime. I mean, these are huge problems ahead of us. And
while we're at it, let's I want to take a second here, and let's talk about the ethanol program.
Okay,
shall we?
So what?
What in the hell? If President Trump wanted to do something effective right now, he would put a complete end to making fuel out of food.
Right.
All right. We are looking at a serious situation in the future about food, and here we sit making ethanol out of corn when we don't need the ethanol in our fuel. We have a glut of oil. We have $20 oil right now. We don't need ethanol. We need corn to feed people.
And so
maybe that we don't feed here corn.
Yeah, well,
maybe we feed people in South America or Mexico. But it's food.
Yeah. So here's the deal. I mean, and this has come up before when you have bad crop years and there's more food needed. We've seen that the ethanol program has impacted people in Mexico not being able to afford food. So that's been stuff, and this is going back years. If you have a bad crop year, you have problems. But right now, about half of corn goes to food production. A lot of it to kind of bizarre things like corn oil, but goes to actual food production, and 37% goes to ethanol. Now, of the rest of it, you
all the
have
corn grown in the United States,
37% is the most recent stat I've seen.
Wow,
that's fascinating.
That's absolutely ridiculous.
Yeah.
That's a lot of.
I would have never guessed that.
Utterly pointless.
Right. No. So now you have.
We have not needed the ethanol in the fuel stream in 15, 20 years.
Well, what does ethanol do? It decreases your mile per gallon. It's hard on your engines, especially small engines that haven't been adapted to it. Like cars have in general, newer cars, but it's like you're getting less per gallon out of it. It's actually making your things more expensive just because of the taxes
and you're implying
subsidies.
for the first time we might need all this extra corn production.
I don't know that the United States will need the corn, but maybe Mexico does. Maybe
we go through a global depression.
We're one of the numbers I've seen is only about 10% of countries produce enough food for themselves. We're a huge exporter of food. So that's grain, that's meat, that's all sorts of stuff like that. And
it's just a tragic shame that we continue down this road when even the Sierra Club, a long time ago, looked at the numbers involved in ethanol production and said, this doesn't make near as much sense as we thought it was going to, and this should be abandoned. But no, we can't do that. We can't stop a government program, even though we obviously know we ought to stop the government program. Which points out a terrible, terrible problem with the whole response to this thing. The government doesn't do anything well. Yet who is running the response to this pandemic?
Right. Yeah, they all point fingers at each other, but regardless of how you want to count whose fault it is that we didn't replenish mass stockpiles and we didn't have testing done right. The CDC points at HHS and all this back and forth stuff. It's definitely the government, that's done it.
Yes.
Yeah, we've been woefully
bureaucrats, all of which have retained their job during this tremendous unemployment
spike.
Right.
So they're able to actually push the costs of their things, both not being prepared and response to other people.
Yeah,
it's very interesting.
Now, here's an interesting thing that I don't think has been talked about near enough. Now, we talked about the potential economic costs of what's going on right now, and we understand that it's whatever it's going to be, and we don't know how bad it's going to be. We do all understand it's going to be devastating. Everybody's had to lay off employees. Everybody that's laid off has been told to sit at home on the couch and color. right? And you just be good and sit down and don't give us any trouble, and we won't give you a $1,000 ticket, right? What happens in 2 years when there's another novel coronavirus? Is this the new normal way to respond to people getting sick?
Certainly hope not.
We
Yeah,
can't have it.
Right. I mean,
so yeah,
We
you hope,
can't hold civilization together
no,
under these circumstances.
No, you hope that the actual the consequences make people realize that, you know what, my life and is not just whether somebody gets sick.
right.
Right?
Yes, right.
And destroying things that are going to affect, especially, the younger people, right, coming up.
Look, I haven't got much time left, I'll be out of here in a little while. I'm 64. But if these idiots destroy the economy, the current economy, and the potential economy, you, my friend, are fucked. You're as fucked as you can get, because they will have taken away your ability to plan anything. Do you know what they have done to this economy by designating some businesses as essential and other businesses as non-essential? Do you see the potential there, the perturbation in investment decisions in the future? It's just
Well, and that's
it's
intrinsically
impossible to calculate what the hell is going to happen
but
here.
Think about this. This is something I think that people ought to push back against, because what they basically said is, your shit doesn't matter. You get up in the morning, right? You get up in the morning, and you get dressed, and you go off and you do what it is that you're doing for work. That's your life you're spending. And they just said, fuck you. You aren't worth shit. Fuck you. You're not important.
Go home and sit down and shut
And
up
you know what?
and leave this to us.
And even better,
Right.
go ahead. I mean, why not off yourself? You weren't fucking worth anything anyway. That's essentially what they've said. At some level, they said, you don't matter. Your life doesn't matter. Really.
Yeah.
So I need to sacrifice my unimportant life and my unimportant actions for this nameless face, this other. And interestingly, the government has designated themselves as essential, when at the same time we know that these people are corrupt and they waste resources. And they accumulate a bunch of money just going into endless bureaucratic things that interfere with us, whether you're in an essential service or a non-essential one, whether you produce important things or things that people think are trivial, So books are non-essential. Amazon's not shipping them.
Right. It's a good, thoughtful question. It's a really good, thoughtful question of what is essential. And that's a conversation. That's another great example of something that's not being had.
We're going to save lives. But
Right.
also, you got to stay in your house and you can't live your life. You can't live to sit.
If the government says that your job is not essential, they're saying to you, you're not essential.
Right.
You're not essential. The government makes that decision. But guess what? The government thinks it's essential. Well, I predict that within a couple of months, for example, the governor of Virginia has shut down the entire state of Virginia until June the 10th.
Governor Blackface?
Yes. Governor Ralph Northam has shut down the state of Virginia until June the 10th. I predict, and I think I'm fairly safe in this prediction, if I keep it nice and general like I'm about to do, a lot of people are going to have a different opinion of their government by June the 10th in Virginia than they do right now.
Well,
I mean, if you demonstrate, I mean, all I can say is that there better be millions of dead people.
well, see, that's the thing.
It's in their interest. Now, this is horrible to say this, but it's in their interest for more people to be dead.
Right. Well,
Although if there aren't, it'll show how the policies.
Oh yeah,
it's a
if
self-fulfilling
there aren't millions
Right.
of dead people, it'll show how brilliant they are.
Right.
that'll be the claim.
Because they
which is completely speculative.
prevented all these deaths. And if there are a million dead people, then, no action was too radical, right? Despite the fact we don't have nobody's got a job, nobody's eating.
Everybody,
left.
If you count those months where you had to be where you were completely restricted, how much life was lost there?
Yeah.
Include that in the stats, because that's also lost. I saw someone on Facebook, they're in a different country, and they're on day 20 of being in their house already. 20 days.
Being inside the house.
Being inside the
Right.
house.
Yeah, it seems imprecise language to talk about saving lives because every human being dies.
Yeah, we're dying. So it may be a
we
change
can prolong
in,
lives.
yeah.
But quality of that life
Yeah,
matters.
but what if we diminish the
matters.
quality of that life to the point where there's lots and lots and lots of old people right now that are not as concerned with staying alive as they are with
enjoying their life,
the time they've got,
Yeah.
and being productive in the time they've got.
Right.
In other words, they are probably in a position to make different decisions about what they do with their remaining years than some jack-off in the county government. Right?
And I've heard
it's I don't know what, if that's not our right, if the rights of society as a whole supersede the rights of the individual, then we've entered into a different model of society than this country has ever enjoyed before, haven't we?
It's very interesting. So what I get, my impression I get from talking to people. So there's people I interact with that are all over the country, and I keep up with different echo chambers. I pop in all sorts of places where people have a completely different set of assumptions and priorities than I do. Just see what's going on. And there's an awful lot of people that they're going along with this. They've bought into the narrative. Staying home saves lives, all this stuff. They're gung-ho. Now, first of all, there's a certain percentage, they're just dying. And, one of the most common things, they're dying to not have responsibility for themselves. And they also want to have more meaning to their lives. So all of a sudden, I'm doing something important. I'm saving lives, all this stuff. And all this kind of various things. And they have this sense of purpose and all this thing. But people's reactions to that vary, number one. But even the people I know who are more individually responsible and are not, so much, of a collective mindset that you'll find in the cities, where by its very nature, you're in a dependent situation because you're in a city and everything comes into you. You know what I'm saying? You're dependent, very unnatural situation. Yes. There's a lot of people, though, that what they're doing right now is they're just like, well, okay, I'll go along with this for right now because, all right. But at what point did they go, this is costing me. This is taking my life and trading it for speculative, saving lives for other people. And it may keep me from getting sick and dying, even though I'm not really in a, I don't have the age or the conditions that would predispose me, but it could happen. When do they go, what the heck? These other people's, I'm being made to pay for everybody else, and it's not making sense. How long are those people going to remain in suspended? Like, well, I'll go along with it and I'll do it.
Yeah, that's what people need to start thinking about. Yeah.
Yeah, like where do you go? Okay, I've sacrificed enough for everybody else.
Are people out there willing to do this for a year?
Is everybody else worth more than me and my family and my goals in life and my interests? Yeah. Am I willing to sacrifice my life for everybody else?
Right.
And is everyone else doing it? And then start counting those numbers, because your life is getting sacrificed when your choices are taken away, when you're not able to conduct business, when you're not able to buy food.
And the longer we stay, the more that question of essential versus non-essential becomes critical. Because, you have people who can go out and actually live their life still, and you have other people who are literally trapped at home.
Yeah, and some of those essential people are feeling quite put upon, too. They're like, hey, you need to come in here and hand out groceries or whatever it is. And they're like, hey, employer, do I have some protection against this shit? And they're like, no. And they're like, whoa, hold on here.
Yeah.
Right? So some of those people are like, they're looking at their risk and going, I don't want to risk for this. They're telling me this. They're shutting up all my friends, and yet they still want me to show up. And you're like, these things don't make sense as a whole. Mm-hmm. But people have to, if they were letting people just decide that for themselves, some people are like, cool, I'll go and I'll get my hazard pay and I'll keep working the convenience store or whatever it is. And other people are like, nope, my mom's old. She lives with me. I don't want to risk her getting sick. I'm going to stay home.
That's an individual decision.
People have different priorities, but making on everybody, especially when you start extending something you might that would be a lot more reasonable in New York City, which has all this, everyone's on top of each other.
Versus
all this
Wichita
stuff.
Falls, Texas.
Versus Wichita Falls versus Wichita County.
The bottom line is that everybody has a different calculus.
Right.
Everybody has a different calculus because everybody's situation is a little bit different. And a 30-year-old power lifter is going to respond differently if he gets sick than a 78-year-old hypertensive heart patient. And but if you make a blanket policy for everybody, compliance is going to be a big issue here.
Because it's unfairly spreading the cost to groups that don't have the same risks.
Right.
So protecting, being super strict at things like nursing homes, which every time there's like 3 or 4 cases I've seen so far where some of this got in a nursing home and they're screwed, Yeah. So keeping these,
But by the same
people,
token, Carmen's mother is in an assisted living facility. They've locked them in their rooms. They've locked these old people in. They won't let them in the hall. They've locked them up.
Interesting. Imprison them.
They've imprisoned them.
Wow.
That's what they've done. They've locked them in their rooms. Now, a lot of those people
It's not how I would want to spend my last days.
are not going to want to spend their last days locked in a cell when they didn't do anything wrong.
Right. Yeah, that's the scary thing. Nobody's being asked. I mean, we're just being told. We're being told what to do here. Yeah.
Yeah, and as usual, the people telling you it are not following their own recommendations.
No,
Quite often locally here,
the beautiful city council here in Wichita Falls, sitting 2 feet apart,
closer than us. Yeah.
Way closer than we are right now, making regulations about how far apart we have to stay. And everybody's getting real tired of this shit. Everybody's getting real tired of this shit. Around here, I don't know about your town or your county, but things are not. People aren't happy about this because of the obvious corruption and graft and everything that now everybody gets to see out in the open.
There's a bunch of asymmetries there, right?
Yes.
Right. So there's ones where it's like you're ignoring that there's asymmetrical risk in different populations and different risk tolerance, right?
Yes.
And then you have it, where these guys, they say, here's what you got to do, and then, let's go to the lake.
Yeah. Let's go to the lake. Let's put Wichita Falls on lockdown, but I think we'll go to the lake this weekend.
Yeah, my family is going to hang out at the lake with,
with other families, and because, we got the money and we got the connections, and we'll just go to the lake.
Yeah.
You sickening pieces of shit.
Yeah. Yeah, so the thing is there's people, and I definitely know people that are very much, they're just, to me, I just think they're paranoid and they worry about all sorts of things, right?
Yeah.
And, they make those choices, but what's happened here is they've decided that other people get to make those choices for you.
Yes.
Right? And in fact, if you want to make your choice about what you're going to do, you are a selfish, sorry person that wants everyone to die, and we hope you die.
Right.
We hope you get sick and die.
Right.
Because you deserve it. And you're like, well, we
it.
see the level of malice that exists in your heart.
Yeah.
You know? But but the thing is, it's like, hey, you can protect yourself. You can stay at your home. You can have your stuff delivered, and when it comes, you can spray it down with alcohol and bring it. Let's sit there for 3 days before you bring it into the house. You can do that. But what you're saying is, because you're scared, other people have to do. Go to your level of risk.
Because you're scared of getting sick, you get to run my existence. That's what you're saying.
Yeah.
And perhaps I'm. I don't know, what would it, selfish? That I won't go along.
No, what's false is they're pretending that they're not being selfish.
Yes, they are. They're saying that their right to not get sick supersedes my right to live my life the way I want to. Now, there's some trade-off there.
So yeah.
That's a gray area. That's obviously a gray area,
Sure.
but it varies with the people involved in the calculation.
The context is always key.
Yes.
Just like the numbers, the context is very important. When you talk about the risk, it's very important. You know, Wichita County isn't anything like, New York.
No.
Nothing.
Right. But yet is
Zero.
under similar lockdown right now.
Similar lockdown,
Yeah.
and partly because, local government's like, well, let's act like we're big and important and push people around. We know what this is. There's no doubt, At least on our level, we have experience with these people. But you're free to be as strict as you want with your contacts, to stay home, not make money, watch TV, eat Cheetos, whatever you want to do.
That's right.
But what you're doing is you're trying to make me pay for your fear. And at what point, seriously, at what point are you so afraid of dying that you will not live your life?
Yeah.
Right.
Being afraid of dying.
Are you
think
so
of that
afraid
there.
of being dead that you will lay down
that you can't live?
and let people walk
And think
all
about
over
that.
your ass?
Just think about that.
And
It's
how long would you do this? Yeah, I think that's an interesting thing for people to ponder. How long? 10 years?
And
10 years?
as we mentioned
5 years?
previously, how many times during your life
Would you do this?
are
too?
you willing to undergo this process?
Yeah.
Because you have just gotten through showing somebody what you will tolerate. Mm-hmm. They are pushing you, and they're pushing you, and they're pushing you, and they're measuring the number of steps backward that you will take. Don't think they're not measuring.
Oh no.
This is a test. People are gathering data, and you are providing them with a very accurate assessment of how much they can do next time. We talked about how bad the data is. The data is horrible. We don't know anything about this, yet we're making policy decisions. When you see things in the media, you see graphs, you see charts, you see death counts, you see piles of bodies in the hall, in the basement of the hospital. You see mass graves, plumes of smoke rising from the Chinese countryside, mass graves, piles of bodies. You cannot just let this soak into your brain without thinking about it first. So what's the right way to evaluate information at this point?
Mm-hmm. Yeah, so the first thing to keep in mind is that a lot of the data it's all questionable, right? None of it is exact. No matter what, even when we get to number of deaths, maybe that's as precise as we can get, but all the rest of this data is really questionable. And then
the death counts, we know, look, there's a body.
There's a body.
Why is it dead?
But why is it dead? Exactly.
Why
right.
is it
why
dead?
Is it dead? Right. And so and then that's often being extrapolated out. So unfortunately, one of the first things we have to ask now is, what's the agenda of the person? In the world we live in, what's the agenda of the person presenting this to me? What's the point they're trying to make? And then does their data, have they cherry-picked data to support their political viewpoint? Because this has become very politicized.
Right. So I think everybody, as soon as, back in January, at least I was following it, things start coming out from China, right? And what's your first reaction? How accurate is that information?
First reaction is that when China tells you they've got 7 new deaths yesterday,
right?
That
doesn't sound right.
That is bullshit.
Yeah. So,
right.
the first thing,
it's bullshit. So don't listen to it.
But my point though is, everybody, as soon as China comes out with information, they go, I don't know what's really going on here. Are they trying to? Do they really have a bad situation and they're trying to damp it down? Is what's going out to us different than what they're sharing in the country? Because there's all sorts of different motivations. But everyone that looks at Chinese data goes, well, okay, that's interesting, but how good is it, right? So initially they had their death counts in this, and then you see, projections. They say how much things were shut down, and then you look at their electricity use. You look at our oil tankers not being docked in the port. So you start to have other measures that tell you how much of an impact it has. But everyone looked at that skeptically.
Right,
okay?
and I think that's the right
Everyone
place
did.
to start. Yeah,
but here's the thing: that's what you need to do in the United States too. That's what you need to do if you pick up the Guardian in the UK. You need to look at those skeptically as well. You are a fool if you believe these people, just on the face of it.
Yes, because they are the media, and they lie professionally.
Because the media, if we've ever had news media, it's a propaganda organ.
Yes.
And there's competing outlets, there's competing motivations, and they all all the mainstream ones work in very close proximity to the governments.
Right.
So they're kind of like actually, you start thinking about it. It's like you have to understand where that's coming from. And if you dig on some of these things a little bit with some of the data you get, you start going, yeah, but then there's this. So let's say it's the Italian data. You go, yeah, but here's the numbers. But the average people dying of attributed in Italy to coronavirus is higher than their life expectancy. You start going, God, how old are they in Italy?
To go back to your question about how do I think about the data? The first thing I ask myself is, I play devil's advocate with myself. Mm-hmm. How could this not be true? How could the opposite of this be true? And I loved what you were alluding to, which is, okay, what's the underlying? So often when we're reading the news, we're just getting the sensational number, the top story. What are they actually quoting? Where's the research behind what they're quoting? Read that.
Go back and look at the source. They're interpreting it for you.
Right, rather than, so you got to actually look at the data yourself.
You got to look at the information yourself as much as you can access it.
Right.
As easy as it is to just read the abstract, this is probably the wrong thing to do. Mm-hmm. Especially in a situation that's critical.
Especially if you're in any position of leadership right now, even at a local level. If you don't have the ability to do that, you need to surround yourself with people that do, and not be taking away sensational headlines and making policy decisions based on a journalist's interpretation of a study. I mean, that's really scary if a politician is making policy decisions from a journalist's interpretation of a scientific article. That's not a person that's qualified to do that.
No.
Yeah.
The other thing in general too is it's become a thing over time. We've been trained to look to the experts. Again, this is just like he was saying, to look at the actual data and just take someone else's interpretation or distillation of it. We've been trained over time. We've been accustomed to, you look at the expert, you look at the guy with credentials. You don't think, because your experience doesn't matter. Your evaluation of the risk doesn't matter. That's how we've been trained over time to react to stuff. But think about it. I mean, just even here locally. Okay, yeah, obviously you don't want to get stuff. You don't want to be around sick people. It might be hard to identify sick people, all this stuff. But it's just like, well, what's your situation? Well, if your situation is you're coming in contact with the same 10 people every day, it's different than if you're in New York City, right? So you ought to be able to say, yeah, man, I'm glad I'm not in New York City. Cities have always been about famine and plague. You know why? There's a bunch of people stuck together. Mm-hmm. And if things go wrong, things get really bad really fast.
Yeah.
Is that different than, out here in North Texas? Yeah, it is.
Right.
So you shouldn't be reacting as much out here as you are there. If I was locked up in my apartment in Brooklyn, yeah, I'd be thinking about a pistol.
Mm-hmm. Yeah.
One way or the other.
Yeah.
Someone's dying.
Right.
Right.
I think one last point to that too. I think if you are thinking critically, you have to, if you're going to read what one expert feels like, find the expert that believes the opposite and read both of their opinions, and then start to form an opinion for yourself. You're really doing a disservice if you haven't looked at both sides.
Right. You can certainly look at something and this seems plausible. Yeah, I kind of like this. Seems plausible. Look at the guy saying, yeah, but he left out that data does this, and I come up with a whole different thing, and then go, what's my actual situation? Because what is your experience is very important.
Right, and then you can use your own experience to fuse those together and say what makes sense here.
Right, you should not be discounting your own experience and your own context for the experts that are completely in a completely different situation. People do that though.
And in addition to that, if you're looking, there are two sides to this problem. There's the disease side of the problem, and then there's the effect on society side of the problem. Mm-hmm.
You have to look at both.
You have to look at both.
You have to.
Like an actuary, you have to look at all of the data because there's a cost-benefit analysis, a risk-benefit analysis to this situation.
Right.
People are going to die.
Yeah. I think
right?
that.
But they're going to die. People are going to die anyway. But like we mentioned earlier, is the cure worse than the disease? Mm-hmm. And we are headed in the direction of hell yes.
Yeah,
it is.
Quite possibly.
It's quite possibly. It most assuredly will be.
Yeah.
Appreciate y'all being here today. Andrew, thank you for coming in. Steph, thanks for coming in. Dr. Mueller, Dr. Bradford have joined us here on Starting Strength Radio. Guys, use your heads. Stay safe, but use your heads. Thanks for watching.